Boston, which is about 60 miles southwest from here, 450 out of 4,200 people, or 1 out of every 10, are addicted to injecting prescription pain pills. So they crush them up, they dissolve them, and then they inject them to achieve a more rapid effect than just swallowing them would. So there's one doctor, no drug treatment counselors, and no drug treatment facilities. And one resident there, Eric Hodge, has been addicted for about 8 years. He injects about 12 times a day and often reuses needles more than 100 times and shares them. He recently found out that he has HIV and regrets picking up a needle and claims that he's going to enter treatment. So addicts are ashamed of themselves, but they have nowhere to go because detox programs are very costly and they're often very small. There's just not the space. And so if safe injection facilities were to be implemented in the United States, then they would be very beneficial to us as citizens. So I'm first going to go over the need for safe injection facilities. Second, I'm going to tell you how injection drug use affects us as citizens. And third, how they have been successful in other countries and could be here too. First, I'm going to discuss the need. In 1997, in Vancouver, Canada, there was a public health emergency declared in an attempt to counter overdose deaths and a spike in HIV and hepatitis C, most of which is from the sharing of needles. Dr. Thomas Kerr called this the most explosive epidemic of HIV infection that had been observed outside of sub-Saharan Africa. So that's a pretty big deal. And today, in Appalachia, in Midwestern communities east of the Mississippi River, like ours, there's been an increase in HIV and hepatitis C. Nationwide, hepatitis C rose 150% from 2010 to 2013, so just in 3 years, with the largest increases being in rural areas. Hepatitis C in young adults has more than quadrupled in Kentucky, Tennessee, Virginia, and West Virginia, with most cases being linked to injection drug use. And now I'm going to discuss the dangers associated with drug use. So if you inject drugs, you are more likely to have blood-borne diseases. You're 35 times more likely to have hepatitis C, which costs about $80,000 over a lifetime, according to the Wall Street Journal. And so hepatitis C is a disease that affects the liver, so it causes cirrhosis or scarring of the liver cancer, or liver failure. And then you need a liver transplant, which the waiting list for that is huge. And also, if you inject drugs, you're 23 times more likely to have HIV, which costs $400,000 over a lifetime. Skin infections are also very common, and they often become very expensive, life-threatening infections because they aren't caught before they develop. And in San Francisco, the uninsured emergency room treatment of skin diseases costs taxpayers about $5 million a year. Another danger associated with injection drug use is discarded needles and public injections. So in Portland, Oregon, dirty needles are often found near playgrounds. And in Miami, Florida, in 2012, there was a survey given to 450 injection drug users, and 2 out of 3 claimed that they had discarded their needles in public places in the past month. And in New York, small businesses with public bathrooms often call in and complain about people using in their bathrooms. And now I'm going to explain how the SIF in Canada has been successful and why one would be here too. First, they aid in preventing the spread of HIV and hepatitis C. So Vancouver, where I said that public emergency was declared in 1997, since Insight, which is the SIF in Canada, it went from having the highest HIV rate in Canada to the lowest. They would also save taxpayers money and save the healthcare system lifetime costs associated with HIV and hepatitis C. So in Vancouver, $17.6 million in lifetime medical expenses is saved each year that Insight is operational. This greatly exceeds Insight's operational costs of $3 million a year. Safe injection facilities also improve public health because they reduce syringe littering in public injections. Within the first 12 weeks of opening of Insight, there was a 50% decrease in public injections. And after 4 years, a survey was handed out to the residents of Vancouver, and 71% of them indicated that Insight had led to less public injections. And safe injection facilities also connect addicts to healthcare services. So when they are ready to access withdrawal management, they can enter on-site, which is on the 2nd floor of Insight. And mental health workers, counselors, nurses, and doctors help them plan for their next steps. And then they can move up to the 3rd floor recovery housing. But like I said previously, space is very limited, so it makes it really hard for everyone to be able to beat their addictions. So as you can see, safe injection facilities have been very successful in Canada and would be in the United States too. because they first, aid in preventing diseases, second, decrease public injections and syringe littering, and third, connect addicts to healthcare services. Another solution to these SIFs is needle exchange programs, but they do not have counseling or treatment available with those because it's just the exchange of needles. And I'm going to leave you with a quote from Chris Byrer, the director of the Johns Hopkins Center in Baltimore. The evidence is overwhelming that safe injection facilities work, save lives, are cost effective, and prevent new infections. And I urge each of you to sign petitions or just continue to talk about these beneficial facilities.
Do you know if the presidents, the nominees are talking about this here?
They're not, the presidential candidates really aren't talking about it. It's more the people in the big cities like New York, LA, Miami, because they see like discarded needles and public injections all the time, so it's kind of in the works.
How could they make it legal to like inject drugs there, but keep it illegal everywhere else? Like, how would that work?
Well, they would, the safe injection facilities would be given government exemptions, so there would be like special laws created where you could only inject in that. So you can't inject outside, like it's still illegal unless you were in there.
But like had the drugs outside the facility or that.
Well, you have to get your own drugs, you can't get them there, but
If you like caught them on the street before you went to the facility.
yeah, you could be arrested, but
That's
I mean, that kind of defeats the purpose of it if they're gonna arrest him if he goes in. Yes?
So do the safe injection facilities like kind of wean you off of the drugs that you're on?
It doesn't so much wean you off. When you go in there, they're like counselors, nurses, they all like talk to you and they try to get you to stop and they present you with all these options that you wouldn't like normally get to try to persuade you. They can't force you to stop. They're just trying to aid in helping you.
If you don't stop off the street and you still go to like the safe injection facility, aren't you just kind of getting like free heroin?
No, you have to bring your own. You can't just.
Oh, you have to bring
No,
your own
you can't just go in there
heroin.
and like, I like some heroin. You have to bring your own, yeah. But if you're not gonna be able to stop it anyways, you might as well have it in a controlled place where you're gonna have people there to monitor it. You're not gonna have, bodies in the streets and dirty needles everywhere.
Would they like change like, so you bring your own like heroin into this facility and then you would like shoot up? Or like would they help you like change it and like give you like lower dosage like to help you get off of it?
No, so like, it's not so much preventing you from using it, it's helping you develop like safer habits, like, so if you are gonna, so you're in a dirty place, you're sharing needles with other people, you're gonna contract diseases that you can then spread. If you're giving clean needles every single time, you're not gonna be spreading those diseases. So, it's not gonna prevent people from using drugs, they're gonna do it. It's just trying to make it safer. Does that answer your question, or?
So if like people start using this and they like overdose and people like are dying in the facility?
They don't die in the facilities, they have people there to counter the overdoses. I talked
Okay.
about it in my last, I don't know, they go in there and if you overdose, like the nurses are watching you inject.
Okay.
So they administer you medicine and you start trusting these nurses and then they start, getting a bond with you, trying to get you to quit.
How would this be paid for?
How would it be paid for? Most likely the government, like I'm guessing taxpayer money, that's how Inside is funded, but most of Canada supports it, like the police support it, the healthcare services, they all support it. So, if the government supports it,